Good evening, everybody. And today's topic of choice is all about complications of dental implants. So I've been performing implants for over 20 years, and one thing I can tell you is they don't last forever. It's really important to portray those elements to your patients and be realistic about timeframes. One thing we don't do enough in dentistry is we don't do enough blood tests on patients. We don't know about their vitamin D levels, we don't know about their HbA1c if they're diabetic, and there are numerous number of medical conditions that can affect the stability of your implants in the long term. I like to explore in my complications series, both in the diploma program that we do and the masterclass that's coming up in complications soon, all about how to manage this. Strategic risk mitigation strategies is the key, as well as having a framework on how to deal with your complications. The consensual process to patients, vitally important to make them understand that these things can happen. I placed around 6,000 implants in my career, and I spend about a day dealing with minor issues, mostly mechanical failure, because there's a lot of people bruxing out there at the moment. I've seen a lot of all-on-4 failures in my career, and it's put the heebie-jeebies up me to always place 4 implants for any particular case. I always place 6 as a backup plan. One thing that you can see in the industry, we are commercially driven. We're not scientifically driven, we're commercially driven, and most of the scientific articles that you'll be reading and seeing are actually sponsored by commercial companies, so it's commercial biased. So the importance of critiquing a paper, understanding the stats, and not believing everything that your rep tells you because there's a new product that's come out, it hasn't been tried and tested, there hasn't got longevity or longitudinal studies yet. We are in an experimental phase of growth of this industry, and it's really important that you are experimenting somewhat on your own patients. Now this can come and bite you years down the line. And the question of how long do you give a warranty for? Is it 5 years? Is it 10 years? Is it a lifetime warranty? What is a lifetime? You know, different things, you've got aspects of what you've got to think about when it comes to complications. And not only in implants, in any aspect of dentistry, you know, it's just long-term temporaries. You know, we are in a repeated cycle. You know, if you get a patient that comes in, it's not stressed, chilled out, you do some fillings, for example, you do a crown, everything's good. 5 years later, he comes back, everything's failing, his life's changed, his stress levels are up, he's going through a divorce. You know, there's a lot of life factors that can affect your longevity of your dentistry. I do not believe for 1 second that we can tell patients what I'm going to do today is going to be there forever, okay? The younger patients that you treat with dental implants, they are the crucial ones to make understand that there's a cycle that they'll go through in their lifetime. So if it's one implant that you place it on 20-year-old, 35 they might need a replacement. Yeah, 50 they'll need another replacement. 75 they'll need another replacement. There are age gaps and stages, and each stage as they get older, the bone quality around and the bone density around that implant's going to decrease. You guys need to understand that when you're practicing implant dentistry, that this will happen, and it is very, very poorly taught. There's no strategic mitigation structure out there for any of us. I certainly can tell you my experience when I was doing my training in 2003. It was all about placing them, restoring them, the prosthesis, seeing amazing dentists in Germany. We went to Tübingen and saw some amazing work. But nobody really talked about how to manage the complications, and nobody really talked about the system I was using at the time, which was Ankylosed by Friodent, and the issues with those particular abutments, which were balanced posterior abutments, very thin-necked abutments, okay? And then fracture. And what do? You call a colleague, you call a friend, you do something. You know, you've got to work out what's best for you. So I hope this was helpful. I think I will be putting a day program completely all online for anyone who's practicing implants to join a webinar dedicated to complications. I'll put details on our new websites, and I hope to see you soon. My name's Dr. Avik, and please do follow me and Dr._Avik on Instagram or on Facebook as well. And I look forward to meeting you soon. Please feel free to DM me any questions or anything you have about this particular topic. Have a great day. Thank you.